When the ministry first started, it was using a relief model for the way that it engaged with its patients. And what I mean by relief, it was a very typical nonprofit that tried to make its services as affordable as possible. But unfortunately, some of the structure that they put around managing the organization limited the number of people that could access it, and only served the poorest of the poor, which had the least ability to help support the organization through fees. So we changed that relief model to a development model. And what I mean by that is that we started to see our patients as customers, and we began to create expectations for them as any consumer would be met with if they were to go into a healthcare clinic. And we're certainly still very, very affordable, but in a nutshell, we ask our patients to help fund the organization by stop relying on us for free services, instead contribute something to the cost of the service that they received. We see so many patients today, and we have such great efficiency today, that even though what we charge a patient is only 25% of the typical fee, the retail fee for that same service in the community, their combined payments cover 67% of our operating costs, which is phenomenal. Most people are either 100% dependent on philanthropy, or the majority of their needs are dependent on philanthropy, and we've turned that model around where our patients are our number one customer, our number one supporter, our number one contributor, which really changed the dynamic between us and the patient. We recognize that we're dependent on you. You need us, we need you. But in order to keep our fees affordable, we sell them for less than what it costs to deliver it. So we still desire and need donors. And we've had many people be with us for years and contribute to us for years, and we're very, very grateful for that.
We've been supporting Good Sam Gwinnett now for either 6 or 7 years, and it's been a consistent thing that we believe in, and seeing the continued growth, I mean expansive growth. To me, I think what any donor should be considering is what's in the future, what could this do? We need to give back to the organizations that are going to last and do what they say they're going to do.
I think as we look to the future for Good Sam Gwinnett, the next 15 years, there's two important aspects. One is who are we going to be able to pass this on to? Who will be our legacy? And the other is keeping an ear to what the Lord commands. And what is God's vision for where it's going to go? Do we open up another clinic? Do we expand our own clinic? How do we better serve the population that we're set up to serve? And God, I think, has been faithful. He's always faithful, and He will show us what the future holds.